Hello, thank you for your interest in the Sovant, the world's first intelligent supplemental oxygen delivery device. In this video series, we will walk you through scenarios that may occur while administering supplemental oxygen and how the Sovant can help. We will start assuming that you have already reviewed the Sovant Basics 1 video and your Sovant is connected to oxygen, mounted, powered on, and have the smart prongs cannula plugged in and you're wearing them. If you have not completed the steps outlined there, please go follow along with that video before proceeding. Now, perhaps your patient is deeply sedated and stops breathing. Take a few deep breaths and then hold your breath to simulate this. After 15 seconds, the Sovant will alert you that no breaths have been detected and prompt you to check your patient. It will also begin automatic apneic O2 flow, which is continuous flow oxygen at the set flow rate. Once you see this alarm, take a deep breath. You'll notice the Sovant gives a much larger bolus of oxygen to help compensate for the time period when oxygen was not inhaled, giving your patient an oxygenation boost when they really need it. Now let's say instead your patient's airway has become obstructed. The respiratory waveform will look something like this, and you will hear a stuttering sound as the Sovant attempts to deliver oxygen. After you take the steps to open the airway, the patient takes a breath and the Sovant will deliver extra oxygen as a make-up breath. Maybe the cannula has slipped out of your patient's nostrils. Go ahead and pull the cannula away from your face. Once the Sovant detects that the cannula has been dislodged, it will begin automatic apneic O2 flow and prompt you to check the cannula placement. Now let's say you are using the Sovant in a procedure with increased fire risk, such as using electrocautery near the face. First off, the Sovant uses less oxygen than a traditional flow meter when in synchronized flow mode, so overall risk of fire can be reduced. Now notice there is a fire risk button on the Sovant main screen. Tap that. You'll see this message which asks you if you wish to disable automatic apneic O2 flow. Go ahead and tap that button. This turns off the Sovant's default to automatically switch to continuous mode in the event that no breath is detected. This helps reduce the risk of surgical fire by avoiding a constantly flowing source of oxygen near fire hazards. Now hold your breath for 15 seconds. You'll see that now when there are no breaths, the Sovant tells you that oxygen flow is paused and prompts you to check your patient. You also have the option to select and confirm going to continuous flow mode. Now turn off fire risk mode by tapping the fire risk button again, then enable auto apneic O2 flow to return to normal use. If at any point you wish to silence the available alarms, you can tap the silence alarm button in the top left corner of the screen. Tap once to silence for 2 minutes. Each additional tap will add 2 more minutes up to a maximum of 10. Press and hold that button. That will silence alarms until it is reset by powering the Sovant off or tapping and holding that button again. Go ahead and try that now. Now that you're familiar with some of the practical applications of the Sovant and its alarms, you can learn more by watching the third video in this series, Sovant 3, using the VEO mask.